we're going to move now into another realm of pain management. We're pleased to have with us today Thomas Cody Swift. Goes by Cody. Cody received his degree in existential phenomenological psychology from Seattle University and is currently pursuing his clinical licensure in California. But the work he's going to share with you today is work that he did with his colleagues at Johns Hopkins University on the psilocybin cancer anxiety study. So this is groundbreaking research in an area of where, like the cannabinoids, we're taking another look at things that became street drugs, but actually have some value and use in the treatment of both anxiety and pain. So please welcome Cody. Do you want the headset or the? Yeah, and I'll get your slides up.
So I know we've all been sitting a long time, and welcome you to all stand if you want and just take a moment to stretch. It's been a long morning. Breathe a little bit. Yes. And you may sit whenever you're ready. And I just first wanted to thank you, Marie, so much, and for this conference, for welcoming in this discussion on psychedelics and very new paradigms for understanding psychological pain, which we'll be talking about today. And yeah, thank you.
So the first screen is a black screen? Oh,
yep.
okay.
Yes, thank you.
It had gone away.
It's dark with darkness. So this has been, even in the last 10 years, a very fast-growing kind of resurgence into the research into psychedelics as a viable treatment for a variety of psychological illnesses, such as depression in cancer patients, anxiety, a host of addictions, alcoholism and smoking, and even MDMA for the treatment of PTSD. And these have proven to be very and remarkably effective treatments. And it's very likely that many of you have seen some recent news media about the research, and even in the past week and a half, there's been two phenomenal articles in the Wall Street Journal by the food writer Michael Pollan, and recently in the New York Times, again, just in the past week and a half. And so I wanted to give kind of an overview of the research in general, its history and applications, but more importantly, I wanted to take this opportunity to really try to give more of a phenomenological felt sense and subjective understanding of how these treatments work, how they're working in one's psyche to bring about these kind of changes, because it is a very different paradigm for understanding psychological change. And before I do, I also wanted to just start with a model for how we are beginning to understand the nature of anxiety and depression, and especially in cancer patients and those with life-threatening illness. And as we know, about a third of cancer patients will be diagnosed or diagnosable for a medical or a mental health condition. And often what happens when a cancer patient is diagnosed with cancer and is going through cancer treatments in the process, and even after deemed in remission, there's a process in which they are confronted with not just the trauma of the cancer itself or the trauma of the medical treatments, but also can usher in a whole wave of new existential realities that they had previously maybe only considered in passing, but never felt the full brunt of it, as in facing the reality of one's own mortality and facing that in a very immediate sense. And so the last presenter talked about getting out of your mind and getting back into life, but if getting out of your mind and back into life includes mortality and the inevitability of death, that's going to be really hard to confront and to welcome that person back into life without really reconciling the fact of death. And we, in our culture, are largely a death-denying society. We don't talk about it. We don't have ceremony and ritual to help experientially condition the body and the mind to have a comfortable relationship, to understand the cyclical nature of life, to have different narratives for easing that fear. So many patients feel on some level that they're going to go off into nothingness, into that darkness. And so cancer patients are experiencing this existential discomfort, the traumas. They're often confronting various losses in their life, losses of certain mobility or bodily function. And cancer can also bring up a whole host of old traumas and old losses, like loss of loved ones in early life. So it's complex, and as a result, people turn inward into this kind of self-referential, negative thought patterning. And a big part of that is they're trying desperately to resolve and to make sense and to categorize all these new realities that they're facing. And they're trying desperately to try to figure them out and to fight them and to overcome the notion of cancer in their body and their mind, to overcome the reality of death. And they're trying to figure it out, and that kind of internal struggle can lead to a kind of depression and anxiety and withdrawal from life, activated sympathetic nervous system. They're unable to slow down, and many of them can't even meditate. It's just too activating, and it really takes people away from life. And what we really want is moving towards a more fluid, phenomenological exchange with our world, to be able to be reopened to our relationships, to nature, to spirituality, to life. Unfortunately, our solution often is antidepressants, SSRIs, which, as we know, are minimally effective for treating depression in general. Only about 20 to 25% of those prescribed SSRIs are actually showing efficacy above placebo. In cancer patients, it's much lower. As one participant in our study said, there was never counseling or anything after chemo. It was just, here are your antidepressants and have a good life kind of thing. There was nothing to help you go back and deal with this trauma that's affected your life. And for many patients, as we know, they don't want to just numb or suppress the symptom. They don't want to just suppress the pain. They recognize, they know that they have been invited on a journey of meaning-making and existential significance, and they want support to work through that. They don't want to just numb out, and we don't frequently have the tools or the tool sets to help people on that journey. And so to really begin to reconcile these significant new realities, we need a much more kind of comprehensive and experiential treatment. And we feel that psilocybin, which is the active compound in magic mushrooms, can really bring about very much a mystical experience that can lead to long-term, enduring and substantial reductions in symptomology. And as William James said, who was the father of modern American psychology, he said, "The keynote of the mystical experience is invariably a reconciliation. It is as if the opposites of the world, whose contradictoriness and conflict make all our difficulties and troubles, were melted into unity." And he actually said this after his early experimentations with nitrous oxide. And there's historical precedent for this. Psychedelics and plant medicines with psychoactive substances, compounds, they've been used for thousands of years, in some cases up to 10,000 years, as the Mestizo Indians in, the Mazatec Indians in southern Mexico with the use of the mushroom, or the Huichol Raratica people in Mexico and their use of peyote, and now the Native American Church, and of course the Shipibo Indians in the Amazon and their use of ayahuasca, which is a psychedelic brew. So the indigenous people have known for thousands of years that these spiritual tools can be powerful healing catalysts, and have been very, I would say, extremely and unprecedentedly generous in sharing these traditions with the West, despite what white people have done to them. And in the last 100 years or so, these tools have been transferred to and begun to be integrated into our Western models of psychiatry and medicine, starting from the late 1800s. Arthur Hefter, who was the first person to synthesize the mescaline compound from peyote, and Albert Hoffman, who discovered LSD in the early 1940s, Timothy Leary, Sasha Shulgin, who discovered MDMA, and more recently, Rick Doblin, who started MAPS, and Dave Nichols, who started the Hefter Institute, and Roland Griffiths at Johns Hopkins, who's my close colleague, and one of my favorite people in the world, Mary Casamano, unfortunately, the only woman in this constellation, is one of the lead guides at Johns Hopkins. So again, a strong historic precedent in the 1950s to the 1970s, over 40,000 people were treated for a variety of conditions with psychedelics, from alcoholism to cancer, anxiety. And in psychiatry, it was considered one of the most promising tools at the time. And the whole research was shut down in the early 1970s, and not because of lack of efficacy or because of lack of safety, but for political reasons. There was a cultural backlash against the burgeoning use of psychedelics and the cultural change that was being ushered in, and probably far too quickly. And there wasn't a lot of containment around how these medicines were being used. So there was a backlash, and all the funding was ceased for the research. In the past 20 years or so, some smart individuals, Rick Doblin and Dave Nichols, realized that it wasn't that the FDA was not open to this research, there just wasn't any funding. So they got smart and realized, okay, we need to start raising private capital, private funding for some of this research. So it's all the recent research has all been privately funded. And so it's important to emphasize this is non-pharmaceutical. And pharmaceutical companies are not interested in this because you can't patent psilocybin and MDMA. So fortunately, there's been generous funding available for the research, and there's been several hundred, over 400 participants have been treated with psilocybin, and none have yielded any significant, serious adverse events. And we do see certain adverse events. Elevated anxiety can happen during the sessions, for instance. But despite the common fear, people aren't running out into the streets or panicking or experiencing full-blown psychosis after, and that's because of the very extensive screening, preparation, support during the sessions, and integrative support that's offered. So it's a very robust clinical container for supporting this, I would say, acute intrapersonal journey that the psychedelics can facilitate. The first study that was conducted, published in 2006 in this new wave, was actually with healthy, normal volunteers, and we were looking at psilocybin as a way to increase well-being and spirituality. And what this study showed is that at 2 and in a 14-month follow-up, over 30% of the participants said that the psilocybin experience was the single most spiritually significant experience of their life. Over 70% said it was among the top 5 most spiritually significant experiences of their life, on par with childbirth or a marriage. And over 60% met the criteria for having a complete mystical experience, which we can actually gauge by way of certain measures. So this was extremely promising, showing the safety, but also the profound mystical efficacy of this tool.
The other medication below
Methylphenidate was the control, and the control that we used in the other trials was perhaps a very, very low subliminal dose. Another study used niacin. There's some controversy around, well, can you really have a placebo against psilocybin? But, it's actually surprising, in these conditions that we implement in the studies, just having an 8-hour session of laying on a couch can be quite powerful for people. So with this preliminary data, researchers in 2008 began a study looking at the effect of psilocybin for the treatment of cancer-related anxiety and depression. And these are with individuals who have life-threatening cancer, not necessarily terminal, but who have significant or later stage cancers. And that research was published about a year ago, completed at NYU and Johns Hopkins. And what we found is that there was an acute, substantial, and enduring reduction of symptomology at a statistically significant level in 80% of the 80 participants who went through the trial. So kind of unprecedented results after a single high dose of psilocybin. And that's probably what's most important to emphasize here, is that these treatments don't require ongoing taking of the psilocybin. It's a single dose that creates a catalytic change in perspective and openness. There's a
question is, how long after did you measure?
This is at 6 months post, and anecdotally, those results extend far beyond too. So we kind of wonder, okay, how could this be possible with psilocybin, and begin kind of piecing it together. But I think it's important to frame this in terms of this image. And this is kind of the typical and archetypal setting of the psilocybin session. And what you'll see is there's 2 guides here who have created a lot of rapport with the participant. They've spent up to 10 hours just rapport building with them, building trust, getting a sense of their life history, kind of practicing going through what the psilocybin session will be like. And they're encouraged to lie down for most of the day and to don eye shades and headphones with the pre-selected playlist. And so it's all to facilitate this very kind of inward journey. So people aren't out looking around, kind of tripping out. They're deeply internal, tripping in, I guess. And the guides are there to support them for whatever comes up, if they have distress or anxiety or they need to go to the bathroom. So they're supported through that whole session. And the guides often encourage them to really try to face and to accept and embrace whatever comes up in that session, even if it's scary. If they see a dragon, dive into it, be curious, what is that about? Try not to resist it, and to try to kind of let go of one's need to understand anything, just to kind of allow the experience to happen. Quick question, yeah.
Is there any physical preparation? As Native Americans do a lot of cleansing and fasting before they use these drugs.
She was curious about physical or psychological preparations, such as fasting, as in other traditions. And there's a lot of psych prep that goes on beforehand, but we ask them just not to eat or eat a light breakfast beforehand, so it doesn't interfere with the psilocybin uptake.
Do they come off other drugs before?
Yeah, SSRIs especially, and certain pain medications, which can interfere with the efficacy of the psilocybin. So just not to bore you with brain modeling, but I think it's very interesting to look at, this is your brain on drugs. And to see in fMRI studies really what's kind of happening, and it gives us some sense of phenomenologically what's going on. In some fMRI modeling, we see that there's, on psilocybin, a dramatic increase in prefrontal lobe activity, where kind of the bed of consciousness is, and there's a decreased activity in the hippocampal region, which is associated with our kind of long-term memories and the constructed nature of reality, and also a reduction in amygdala response. So what is really happening is people are able to have a widened consciousness, a widened view and experience of themselves and of reality without the normal constructs coming in, trying to frame it in different ways, and actually a reduction in their fear response. So there's an openness to consider a widened view of oneself, and also perhaps of death and even their cancer. Another model shows what they deem as the reduction in the default mode network, or kind of normal patterns of thinking, and a vast new communication that happens in the brain, where the brain is now communicating with disparate regions of different parts of the brain, and creating new pathways for perspective and of experiencing, which I'll later show how that really plays out subjectively. So here's a picture of the psilocybin, which is by DEA requirements measured daily, as to try to reduce the risk of diversion. And what we'll see is people are actually not inclined to want to do psilocybin again after they've done it, at least not anytime soon. But DEA is very rigid. We've done dose response studies, and so there's been some kind of tweaking of that, but we've landed on what we feel is a dose that pretty reliably facilitates this more transcendent and mystical type experience. So these would be, fairly high doses of psilocybin, on the equivalent of like 4 to 5 grams of dried psilocybin mushroom. So a qualitative study that I conducted with one of my colleagues, we interviewed 13 of the cancer participants who went through this trial as an attempt to understand what was really happening internally to them, to get again a more nuanced, subjective sense of what this was like and how this healing is happening, because we don't feel like it's purely neurological or physiological, that something's just happening in the brain, but actually that it is the journey that people go through, that the psilocybin is a catalyst that allows this deep experiential, existential, and very meaningful journey in which facilitates the changes that we're seeing. So it's a very different paradigm than give someone a pill and then symptom reduction. This is give someone a pill, facilitating a deep hero or heroine's journey and coming out with dramatically new learnings and perspectives. So I told Marie that I was just incredibly excited and thankful to be speaking to a room full of nurses, because I've heard that nurses, more than any other population, embraces and understands the value of qualitative research. So we're trying, yes. So the first question that we asked these cancer patients was really trying to get a better sense of what it was like for them to live with a cancer diagnosis. This is before treatment, thank you. One participant said, "You realize you're going to die. I don't know that you realize that until you're told. I was told that I had a 50-50 chance of being alive in 5 years. As soon as you think about having a limited time for living, it changes everything." And another said, it triggered something that I seemed I could not get out from under. I just said it, I'm dying. And a lot of the participants described that overwhelming quality of being confronted with the reality of death in their lives. And a lot of them didn't know what to do. They had tried everything. They had tried psychotherapy, they had tried antidepressants, they tried distracting and running from it, and different alcohols and medications, and nothing was working for them. So the psilocybin treatment was really not just a last resort for them, but it was also a hope for a different model and something different for them. Another participant, just important to kind of emphasize this nuance, is that for many of the participants, the anxiety actually didn't come fully until after their cancer treatments were over. So this was, they're kind of done with the medical system. A lot of the family support is no longer there in the same way. They're supposed to be better, happy, let's celebrate. But that was really when these realities of this new existential landscape really hit them. They were no longer actively working on fighting the cancer anymore. And this is kind of when the depression set in, and they could no longer kind of return to their life before the cancer. This participant said, it wasn't until I started getting towards the end of my treatment that I started having real problems with anxiety. There was a part of me that couldn't really believe that it was over. The first time I had a follow-up CT scan, I was freaking out. I was just a mess. So this is where the psilocybin comes in. And we actually present it in a kind of a ceremonial gourd honoring the the Mazatec traditions in Mexico. And this is, of course, synthetic psilocybin that's administered in a quantity by body weight and given in a single capsule. And again, this is a double-blind, placebo-controlled trial, so the guides who are with them don't know what they're getting. Kinda. This is the session room at NYU. So this is in downtown Manhattan at the New York School of Dentistry, actually, is where they're given their office. But they transformed it into kind of a beautiful and serene living room space. And I have a breakout session, and I'll kind of go more into the protocols and how we set up the treatment model and ensure safety. But if there's any other questions around that, you can ask. So I think what is perhaps one of the most important phenomena to emphasize in this, and it's really hard for us to understand until you're actually in it, but the psilocybin facilitates a deeply, deeply immersive experience. So very much kind of like a dream where you are in that dream landscape. But even more than a dream, this experience can be extremely visual for people. But again, it's important to emphasize because the insights and the realizations that come for the patients are not just grasped intellectually or cognitively, but they all reported that there was a felt sense of what they were going through. So they were in that experience. As one participant said, it was a feeling beyond an intellectual feeling. It was a feeling to the bottom of my core. And that's one of the reasons it's hard to talk about. It's beyond words. Another participant said, I had feelings of being connected to everything. I mean, everything in nature. It wasn't like talking about it, which makes it an idea. It was experiential. Words fail me. I was at a loss for words because it was all so beyond words then. And we feel like it's really the kind of the surrender into this very vastly different landscape of consciousness that is a big part of where the healing occurs. Again, it's not just an idea of wellness, it's an experience of that. And this is actually where some people who take psychedelics can get caught up into panic and anxiety because it can feel overwhelming, and for the first time in one's life, letting go completely of one's normal consciousness and one's sense of self and sense of all reality. And so this is where the controls of our clinical trial really come into play, and in terms of preparing for that and reassurance as those anxieties come up.
And what's your protocol for follow-up with your patients? You repeat the question. What's your protocol for follow-up?
Mm-hmm. Let's see.
For, like,
Yeah.
optimal processing?
Yes. Yeah. We do have several follow-up sessions, and then ongoing phone calls, and then there's a couple long-term follow-up sessions that we have. Yeah. So again, this is kind of the edge where people can begin to enter that sort of nadir or dark period in a psychedelic state. As one participant said, I was watching everything disintegrate, my past, my relationships, my personality, everything that makes me feel like me, and that was terrifying. So as we saw before in the brain modeling, kind of that breakdown of the default mode network and the reduction in activity in the hippocampal region, this is what that maybe starts to look like experientially, kind of the loss of everything known. And that can be a little bit scary or actually terrifying for some participants. And another said, "It hit me very strong, and it was terrifying. Absolutely nothing to anchor myself to, no point of reference, nothing, just lost in space, just crazy, and I was so scared." But then I remembered that Tony and Michelle, who was her guides, were right there, and I reached out my hand and just said, "I'm so scared." And I think it was Tony who took my his hand and said, "It's all right, just go with it, go with it." And I did. And it's so frequently that moment of surrendering into the experience that led to the most dramatic realizations and breakthroughs in their psychological process. The two participants actually spoke to why this struggle was so essential for them in their healing. One said it was an intense struggle, and that's where it became medicinal, because it allowed that struggle to happen. It didn't coat it. It wasn't an antidepressant. It brought it all out. And I think we hear that often with our cancer patients, that they don't want to just be told, "Oh, honey, everything's going to be all right," or "The grass will be greener on the other side, don't worry." They don't want, dull, kind of empty platitudes. They want to know that they have it in them to go through the darkness if that's what's there. And this experience can often give participants the opportunity to enter that struggle and face that darkness and face those existential realities in a very palpable, in a very acute way that allows the resolution to happen. Whereas before, the notion of death and cancer, it kind of can be intrusive at random times, and there's no way to catch it. And this brings it right there. There's one.
So if I'm understanding you correctly, this is used as like a one-time treatment or experience. Is that, or is there?
Yeah, this is a one-time single administration of the psilocybin with, a lot of support and integration. Some of the other trials, like the early smoking trial, had 3 psilocybin sessions. The follow-up is going down to 1. So there's different approaches, but the results have been, in the study, were from a single administration of psilocybin.
Criteria on if someone has a drug history?
We tried to exclude all those with previous use of psychedelics to try to get psychedelically naive participants.
And counseling follow-up, it sounds like there's 10 hours or so before you have your experience, just in the counseling field.
Yes.
So unsure on how that looks for that follow-up of opening up all of this.
Yeah, it's I won't go into the details of what, but that it is essential, we feel, to have that kind of support. For anyone to go out and take psilocybin on their own, there's a chance that they could experience such healing, but it's far more unpredictable, and this creates the predictability of the conditions that frequently lead to this kind of healing. Maybe we can save it. Yeah, okay, thank you. Another participant said of this difficult part of the experience, "It wasn't pleasant, but part of it is like, I can get through anything. I know I can get through anything now," and that was very real to me. So again, speaking to the importance of this struggle, and part of this this ego disillusion that led to some of the distress that we were just looking at may be that which also leads to the kind of healing and meaning making that we're seeing. And for some of the participants, the experience of that kind of that complete loss of self was framed and understood and felt very, very palpably in a very real way to actually be the nature of death itself. And as one participant said, I was not here anymore. I was not with my body. I thought to myself that this is death, that is death. And it was scary, but I remember I said to myself, oh, if this is death, it's not that bad. At least there's something. It was exotic and unknown, mysterious, something I would not mind being in because I would love to explore that. So even if after the experience they're not connected to that experiential place so palpably afterwards, at least there's an opening of possibility of something else, that there could be something after death. It gives them an experiential reference point that can create some distance in that closing down of the fear of death that they may have been stuck in. Another participant said, and this is very Pacific Northwest, I feel, I felt like this was really dealing with death, and she saw herself in a forest. She really described experiencing this. I'm in the forest, and there's this beautiful, loamy, woodsy, green, lush kind of woods, and I'm down below the ground. And it felt really, really good, and I thought, that's what happens when you die. I'm going to be reconnected with this beautiful world, this earthy world that we live in. It was just simple. It was gorgeous. So again, not just an idea. She really felt this. Let's see. Another key and very interesting feature is that many of the participants describe not only a reconciliation with death in that way, but actually with their cancer itself. And the title of our qualitative paper was "Cancer at the Dinner Table," from this quote. And this woman, she had this very palpable vision of this dinner table. And at the dinner table was her cancer. Her cancer was there at the table. It was almost this round circle that represented a dinner table, and at the table was cancer, but it was supposed to be at the table. And the feeling I had was cancer is a part of everything. It isn't this bad, separate thing. It's something that's a part of everything, and that everything is a part of everything. And that's really beautiful. It was just sort of an acceptance of the human experience, because it's all supposed to be this way. Everything just felt unified, which really harkens back to that William James quote, and that this woman had felt like she was constantly having to fragment her life between what was good and bad, and her body being, bad, and this cancer, this bad thing, and to really have a very palpable moment of acceptance and embrace of that cancer is, it's such a gift. Another participant said, and then I came to the epiphany that these lumps, so he had lymphoma and some vestibular lumps in his neck, you should accept them. They are part of you. They are part of your past. They're part of what happened. But there is no reason why you should hate them. Accept them as a part of your history, and you take care of them. So part of that, you take care of them, is that it's important to emphasize that the participants are not kind of in a place of kind of a new ignorance around their cancer. It's not like, oh, I've accepted it and I'm, no longer going to go forth with my, medical care or anything. There is just a distancing and a loosening of the triggering nature of the cancer. So they still continued their treatment. They were still, on top of that, but there was just a an easing in terms of their relationship to the cancer. It's kind of important to touch on, again, kind of the depth of the mystical aspect of this treatment. And one participant said, if I were religious, it definitely would have been a religious experience. I would have said bathed in God's love. I don't think English really has a way to say this without using that word God. Maybe bathed in transcendent love or universal love. It was such a strong feeling. The psilocybin opens you up and connects you. Everything is interwoven, and that's a big relief. I think it does help you accept death because you don't feel alone. You don't feel like you're going to, go off into nothingness. That's the number one thing. You're just not alone. And this participant went on to say how she felt like psilocybin could be really effective and important and even in hospice settings for those at the end. And medically, there is some precedent for that because psilocybin can have, some momentary activation of the heart and elevated blood pressure, but generally it's fairly safe and easy on the body physiologically. So kind of looking at some of the outcomes, the qualitative outcomes as participants described coming out of the psilocybin session in the months after. So we conducted these interviews 4 months after their psilocybin session. One participant, again, kind of speaking about her session, she said, "It was surreal because I never remember my childhood. During the psilocybin session, I got that sense, that whole feeling of like everything is just right. There are no insecurities, there are no life responsibilities, there's no daily grind, there's no cancer, there's no nothing. It's just this pleasant childhood where I ran around after school and played. That feeling of freedom, of just not having that weight and burden of dealing with life and death." So what we found is that what seemed to be really healing was not just the reconciliation with these difficulties that they were facing, not just coming to terms with or a deep acceptance of death and cancer, but actually on this transcendent level of reminding people of what is good and special and glorious and abundant of their lives. And for many of the participants, this wasn't just a way that they were disconnected from the cancer, but had been for much of their lives. And the psilocybin re-inspired that sense of how much there is in life to appreciate, and connected them in a very significant way. Another participant said, and this is after their session, 4 months after, "The percentage of my life that I'm able to be present in just a moment has increased dramatically. Just to lose yourself in the moment, it is unique and monumental." And he went on to describe how he felt this works. And he said the psilocybin allows in a greater appreciation of that which is around us all the time. I don't know, I just feel like it's part of me. Anything I experienced with the psilocybin, I don't see it as a drug having an effect on me. It's all a part of me. So again, it didn't feel like that the drug was imposing or bringing in these hallucinations or these outside things, but it catalyzed a deep revelation of everything that was already there, that perhaps had been shut down because of the long traumas of life or the traumas related to cancer. Another participant said, from the psilocybin experience, I felt like a whole bunch of crap has been dumped off the surface. The stuff that made my world shut down so much and made me look at the ground and watch the clock numbers clicking by. There's life and so many things going on. Just watching that tree over there blowing in the breeze, seeing the people in the street and all the different people and vehicles rushing by. I feel good about being alive. It's like waking up in the most profound way, that this is really what life is. So again, looking at how this developed in people's relationship with death and cancer in an ongoing way, and many of them really recognized that they were still very angry at the cancer, or like one participant said, it's not like all of a sudden I'm cool with death, but I'm just not as obsessed with it. And a lot of participants said a very similar thing, that it's not in their ruminations anymore. It's not something that they're obsessed by. When they have a follow-up CT scan, they're not activated anymore. There's just been an easing. One participant said, before I thought, if my cancer recurs, I don't want to die in misery. I will just figure out how to kill myself and not deal with this. And truthfully, I don't even think about cancer recurrence now. I really don't. But it is not a decision, it is a feeling. It is a change in how I feel, that I can speak this way and be this way. Again, it's not something I focus on anymore. I don't focus on cancer. I don't run to the doctor right away to make sure I'm going to make it or whatever. Since the psilocybin treatment, I know for a fact that was a huge change for me. It's not a priority. It's not the thing that controls my life. So this is to give you a felt sense of how the treatments are integrating in the participants' lives to lead to the significant reductions that we're seeing in symptomology that are sustained after a single dose of the psilocybin. And so from this research in 80 participants, this phase 2 trial, we are now moving towards working with the FDA to design a pivotal phase 3 safety and efficacy trial, at the end of which the FDA will make a recommendation to the DEA based upon that data to reschedule psilocybin for clinical use. And so it's very hopeful, and we've had to raise a very significant amount of funding for the research, but it's promising and moving forward. And I'm just gonna pause there for a moment, because I know I've said a lot. I'm just, again, so hopeful for this research. Even if it may not be a tool or an option for everyone. And for instance, we screen out people with any history of significant mental illness, like psychoses and even major psychotic episodes in one's family, because there is some evidence that, for certain individuals with a high propensity to schizophrenia or bipolar, that, that these treatments can, push people into that space. We haven't seen that in the research, but it's important to be careful. These are strong tools. But for those individuals who are sound mentally and physically, and for those who want to enter into their consciousness and unconsciousness in a different and deeper way, and don't want to just, again, reduce their symptoms with an SSRI, or they don't want or haven't had much success with psychotherapy and want to try something in a different way, to really go into that experience. This could be a very, very viable and effective treatment and possibility. There's one question.
Do you screen at all for religiosity or any belief, is there a consistent belief system or lack of belief system, or is that actually part of your screening?
It's an interesting question, and it depends on the particular trial. For the cancer trial, there was no screening on that criteria. I think the majority of the participants were atheists, but we do have a trial going on right now at NYU and Hopkins where we are recruiting active religious clergy to undergo 2 high-dose psilocybin sessions of diverse faith traditions, yes. So, a lot of Episcopals and Presbyterian ministers, but also rabbis, and we haven't had an imam yet. That's the one we're looking for. So, Eastern traditions, yes, we've had a Buddhist. I don't know if we've had a Hindu priest.
Just about out of time.
Just about out of time.
So
Okay.
I was going to grab the microphone.
Sure. And I would say, too, that, we are looking at a variety of other indications. There's 2 large-scale phase 2 trials going on right now looking at psilocybin for the treatment of smoking cessation and alcoholism. The early pilots for those studies showed efficacy far above 60 or 70% abstinent rates. So really, again, unprecedented results after only 1 or a few administrations of psilocybin. And the religious clergy study, we also have, we're looking into psilocybin as a treatment for opiate dependence, eating disorders, early stage Alzheimer's, and entering a large phase 3 clinical trial, MDMA, for the treatment of PTSD and treatment-resistant PTSD, actually, and primarily in veterans. So that's a very promising area as well.
So my question, sorry, is that? I can do it.
My question is about, wouldn't it be an important aspect to maybe use as part of your control, having participants go through some sort of a short but multi-session group to learn about and how to talk about death and dying? And because it seems like a lot of the participants are talking about release of their fear. And it just seems like that might be something that might be as valuable to measure as using a placebo drug.
Yeah, it's an interesting question. 2 parts to that is that we are seeing with the control group that many of them are experiencing some positive results because we're creating a venue where they can talk about their fears around death and dying, perhaps for one of the first times. And and just kind of riffing off your suggestion, I think we need a support group to help people talk about their psilocybin experience to their loved ones, because that can be challenging.
Okay, so we just have
Yeah.
time for one more question.
And I do have the breakout session if there's ongoing questions. Yeah.
Thanks so much for this. In the growing field of psychedelic-assisted psychotherapy, the downscheduling of this, do you think that will allow therapists to legally work with clients using psychedelics?
That is the dream and the hope and the hard work. We can't quite anticipate what schedule it will move to. I mean, I was just talking to a researcher yesterday, and he said, you know, just purely based upon the data, that this should be Schedule 4. You know, that this shouldn't even be Schedule 2 because it's so much more efficacious and so much safer than cocaine, for instance, Schedule 2. Probably Schedule 3. We don't know how the FDA will sort of require a certain certain protocol to surround the administration, but we are hoping that it will very closely mirror what we've done in the clinical trials, and there will be treatment teams that will need to form with, you know, medical supervision and psychotherapists. But even in phase 3, the FDA allows a provision called expanded access, which can allow therapists and teams to begin working with these compounds clinically while still in phase 3, not in the actual research context. So very soon, in the next couple of years, it may be that this will be available for a lot more clinicians to begin working with. So,
So let's thank
Thank
Cody
you.
for his
Thank you.